I'd like to invite Dr. Shreyas to talk on incentive and setting targets. Does it make or break? I believe this is one of the wonderful topic of the session. And over to you, Dr. Shreyas.
Thank you, madam, and thank everyone at ARC for this opportunity. And so this is a challenging topic, one that probably the only topic that I had to really prepare for in this AIOS. And I would not still say that there is a single formula which works, just like how our entire clinical practice is. Each patient is different, each surgical planning is different. I think we have to be very pragmatic about how we approach this entire role of setting incentives and targets. This talk is essentially aimed at people who are running individual practices, people who are running group practices, people who are running chains of few branches, multiple branches. It's not really for the teaching hospitals or teaching institutions, because the aim of people working there is very different. You work in a hospital where you're going there primarily for your surgical training or for your career growth in terms of your clinical experience and clinical expertise. Your role and your mindset there is quite different from your place where you're working as your regular job, where you're looking at growing, not just in terms of clinical skill, but also monetarily, financially, and in stature as a particular individual in terms of roles, responsibilities, growth, maturity. So many things which come into play when we are actually setting these particular incentives and targets for each and every individual. Really, the aim is to bring the team together. The goal is really to bring the team together. It's to motivate them. It's to encourage teamwork. And while encouraging this, while trying to achieve the goal and in maintaining this teamwork, you will definitely strive for excellence. And the whole system is towards giving them a certain reward for achieving that excellence. And at the end of the day, this means faster growth, not just for the organization, but for the individual as well. And it is important for the individual to recognize that they will grow in tandem with the organization. That if the organization grows, I will also grow with the organization. And that is a thought process that needs to be inculcated in each and every member of your organization for it to grow together. Ritika gave us a lot of inputs on how to bring patients inside. But once patients are there with you, it is your team on the ground who is going to ensure that they have an overall happy experience, great experience, so that they bring back more patients. And for that, this motivation is necessary. So who do we incentivize? You can start from the center head and the center manager. There might be a doctor, a medical superintendent, or it might be a non-medical person. Your individual doctors who are taking care of different branches, different specialties. Most importantly, optometrists and counselors. And then, of course, your optical and marketing teams as well. And why not the entire group? Why not every individual staff member who may not be incentivized for every small thing that they do, but there is an overall goal. There is an overall goal that each branch or each hospital tries to achieve. It might be just in terms of the number of OPD they have seen in a particular month. It might be number of surgeries they have achieved in a particular month, or it might be an overall revenue. In case you just don't want to make it revenue based, which we have done so in quite a few of our own centers, where we look at a overall surgical number. Let's say last year they did 1,000 surgeries. This year you want them to go up to 1,100, 1,200, whatever you... And this goal or target is not set by an individual. It is actually set by the team. It is brought forth by that hospital team. They discuss amongst themselves. They set a number and they say, this is what we would like to strive for. We will reach this number. Give us a bonus for reaching that number. Help us to reach that number. We need these aspects to reach that number. So it actually makes every individual team member also think about what they are going to be doing this particular month or this year for them to reach that particular goal. So let me start by individual this thing and let me try to get a little bit more into the nitty-gritty about various incentive patterns, what challenges are there, what benefits are there. So the center head or center manager is really, at the end of the day, your true leader. Now, it is important if you're running multiple centers, to have leaders in each of these centers. And it's impossible for any one particular individual to be looking into every aspect of every hospital. So if your de facto leader, who is your center head or center manager there, who's a doctor, may not be a doctor, depending on the type of center you're running, he is responsible for the overall performance of the center. Good or bad, he is responsible. So it is important that these people are directly linked to the overall performance of the center and not just for their own individual contribution. Although their contribution might be most important, he might be your star doctor of that center, might be doing the maximum surgeries, but if it comes down to only his contribution, he will look at only his numbers, his growth and his particular this thing, rather than looking at overall what the team achieves. So that doctor may have to look into what the optical person is doing, what the pharmacist is doing, what the receptionist is doing, what the floor coordinator is doing, what the counselor is doing. If you want to inculcate that, link it to the overall performance of that particular center. There are two ways of doing it. One might be revenue, the other might be looking into the profits. Now let me discuss a little bit more about linking it based on revenue versus linking it based on profits. Now the advantage of linking it based on revenue is that they concentrate more on the clinical care, talking about the patient conversion. This is quite comfortable for a lot of doctors, optometrists, who are going to be involved in your clinical care, involved in ensuring that the patient undergoes that whatever treatment is required for them at your center, ensuring they have a happy or a good experience at your center. But they are not in charge or not responsible for the daily running costs of that particular center. And they don't have any role in the daily running expenses of those centers. So for those individuals, basing it more on the number of surgeries or on the revenue is a better deal than profit. But where profit actually comes into play is people who have a direct role on maintaining the expenses. So even looking at the cost of electricity, the daily expenses, cutting down on unnecessary consumables, unnecessary costs, extremely important for an efficient center to run. And it is important for those individuals that they look at the profits, whichever way you look at it, into that. Not only that, being aware of certain costs is important for every individual, even including the doctors. It is important for them to know what is the cost to the patient versus what the hospital is getting. At our center, we have a standardized pricing. Whether it is an Indian IOL or a foreign IOL, the margin what the hospital gets is the same over an Indian or a foreign IOL for let's be it a toric or a multifocal IOL or any IOL. So it is important that you choose what is best for the patient without prejudice. So when you directly link it to revenue, sometimes there might be a unnecessary push towards high-end IOL or high-end surgery just to rake up revenue. But that's really not the idea. That's not the concept. While you want to encourage premium procedures, you want to encourage torics and multifocals or any other subspecialty, you want to switch over to the high-end refractive procedures, you want to offer the very best to your patient. But at the very same time, it's also good to be conscious that while you're offering the very best to the patient, are you providing an additional quality to the patient? If you're delivering the very best, nowadays I'm proud to say that our Indian companies are giving us lenses and products which are just on par with the international ones. I don't see any difference. So when there is no difference, then why not have a pattern which your own staff, your own team, your own doctors are aware of that and don't have any bias or prejudice between one versus the other. Individual versus team performance is a point which I like to allude on. If you have a group of individuals, either optometrists or doctors who are handling a particular specialty, please make it a team. Always prefer a team performance. One person might be performing better than the other. One person might be senior to the other. Fine. Change the ratios. Have a higher percentage of the overall pot going to the senior person. But always make it a team-based one rather than individual, because this promotes better teamwork and reduces infighting. Specialty based, to improve the specialty work in each center, ensuring that it might be a specialty which may not. Encouraging that specialty is really important because it builds to the overall image and overall picture. Striking a right balance is important. Knowing the mentality and temperament of that particular individual as to what they desire, as to what they want for themselves is an extremely important aspect in setting these incentives. And it's important that you recognize the roles and the mindset of your senior optometrists, your senior doctors, and adjust it and fine tune it according to their needs. Optometrists, I strongly believe, are our most important facet in our organization. While we have excellent doctors, the optometrists are the backbone. Because at the end of the day, all our counselors, the senior ones, are all senior optometrists. The very important thing is that they are able to give them a certain clinical counseling from a clinical angle. Otherwise, a regular counselor, it becomes a more commercial aspect, more discussing about the cost and other angles, whereas an optometrist is able to give them a clinical angle. And very often, I find a patient who has attended a counseling with one of our senior optometrists comes to us and then says, that doctor said that this would be best for me. I never correct them and say that, no, he's not a doctor and he's only an optometrist, because I feel proud of the fact that my optometrist was able to give that kind of information where the patient felt he was truly listening to a doctor. Your doctor is in fact your best counselor. The reason for having your counselors or your optometrists do this counseling is because, again, maybe the sufficient amount of chair time may not be given. And in our system, our patients, once they are diagnosed by an optometrist for a particular problem, they go ahead and attend the counseling and then go to the doctor. The reason being, it becomes easy for the doctor then to discuss the nitty-gritty, the finer aspects, and that really makes it even better. And incentivizing optometrists really improves in the overall performance of the center. Counselors, again, like I already mentioned, you can either have a case-based incentive wherein they have, for the individual number of cases that they fix, they really look at the conversion, look at the aspects of overall number of patients that they have counseled. Or you could have an overall strategy of the total number of surgeries done irrespective of value. And that, I think, also works very well, because here they are trying to talk to the patient about each and their individual needs, and they are trying to reach an overall goal and overall number rather than trying to look at what revenue or what profits they are gaining from a particular patient. And that is another strategy which works extremely well with the counseling team. Opticals, again, have a very, very important role, and they are a typical sales team. I mean, whatever said and done, we are not doing any charity in our opticals. You should have an important person in the opticals who analyzes and understands the needs of his optical individual team members and how they are projecting themselves to each and every patient, who is able to recognize the costs, the average sale price, or this thing of each and need of every customer, so that you offer the best, but at the same time price it appropriately. And when they are aware of all of these things and incentivized according to it, they have a great responsibility and do give a good performance. The marketing team, again, are definitely tuned towards this. It might be your referral marketing, it might be your CAM team who's bringing in CAM surgeries, corporate team. People very often used to say that the more the revenue, more the incentive for a marketing team. Not necessarily the case. For even a CAM team, which is extremely important for a particular center, bringing in lower cost surgeries, lower end procedures to that center to increase the name in that particular area, they have a very, very important role to play. Though the revenue itself may not be very high, the numbers were built to the practice, and it is these patients who then lead to the growth of that practice. So incentivizing them on the number of surgical numbers that they bring in, the total number of patients that they bring in, is extremely important, even to those people who are going and conducting low cost camps or free camps, even for that matter.
Shreyas, could you please?
Yes, sir. Yes, last. So at the end of the day, like I was mentioning, after each individual, it is even the overall team that can be given. You achieve a particular goal and get an additional bonus, and that is where the overall team is oriented towards it. Your right from your basic staff is involved in it, and it need not always be money, which is a bonus. It could be an award, it could be a recognition, it could be an elevation in post, and each of these also have a great role to play. And I know there are organizations in our country. I had the good fortune of working in one of them, where there is incentives even for publications. For you publish more, your appraisal is better, your incentives are better. And that definitely brings in a very positive overall attitude in many of these individuals. The main reason for having this is to bring in a sense of ownership. Each senior member of your team feels that they partly own the hospital. Whether it's 5%, 10%, whatever it is, they feel that they are partners in this hospital. There is a greater motivation for them to do the routine work. But it is important to have adequate controls in place, ensure you have good clinical audits, internal audits, so that ethical standards are definitely maintained. And at every point of time, when you're setting a goal, when you're setting a target, when you're setting incentive slabs, if you keep reiterating the fact that you don't want a single procedure, surgery, investigation, which the patient does not deserve to be done for that patient, and you keep reiterating and keep drilling it at every meeting, and start with this at every meeting, then automatically it will also be inculcated in them, and they will maintain the ethical standards while they try to achieve better patient conversion. Do we always have to incentivize? There are a few good men and women who are really not looking at incentives as the only aspect of growth. And I'm very happy to say we are blessed with many such individuals in our organization who are an integral part. But it is important that you recognize them, but still reward them. They should not feel left out. They should not feel just because I am not concerned about my incentives or my individual remuneration as much as XYZ, that I am being left out in the overall growth. Do take care of them and ensure that they feel that despite whatever the extra hard work and personal effort that they are putting in, that they are adequately rewarded for it. What can go wrong? I'll finish quickly, sir, with this. They feel that they are working more for an incentive, some individuals, than for their salary. Any additional work, any additional responsibility, the question is why? What is in it for me? So it is important that you strike the right balance. It is not possible for every individual to have the same mindset, to have the same level of motivation. Some may say, I put in the same hard work as another person, but I did not achieve the same outcome. So why is it that I'm not getting? So these are some of the flip sides which you need to keep in mind, be aware of when you're setting incentives, when you're setting patterns for each individual, and ensure that you motivate them, but at the same time, it doesn't go to the overall extent. And one good way of doing it is to have a very good multi-pronged appraisal, and that your appraisal is just not based on the numbers or revenue, but the overall so many other factors which should come into play. And every good organization which has a strong appraisal pattern ensures that these individuals who feel that they are putting in adequate hard work and are genuinely putting in hard work are rewarded at the end of every year. So incentives and goals, I do believe, are a great motivator. It's important that we strike a balance and maintain integrity and core values while we set about this entire process. Thank you so much for your attention.
Thank you very much, Shreyash. That was an amazing talk, and I just incidentally walked into the room, and I'm really proud of you. And I think all the leaders sitting here in this hall, this young blood in an organization brings in a lot more energy to everybody, and you are the young blood sitting there. And I would want each of you to come up with different energizing talk over the next couple of years you are with us. Very good talk. And I would want one question to ask Ranabir, who runs another major organization and again another young blood. What is the single most downslide to incentives and targets? Shreyash did allude to it. What would you say in your setup?
Yeah, variable pay is always a double-edged sword. I think what Shreyas rightly mentioned is if any work is given extra compared to what is incentivized for, they say, what is it for me? And that happens, especially in sales-based roles in opticals, that you give something extra to do is like, why should I sell this or why should I promote this? So I think setting the metric for evaluation is the key for variable pay, and we have to be very careful. If the metrics are not correct, you should not have variable pay. If you are jumping it into variable pay, then I think the metrics are the most important part of
I think incentives would be, there would be a basic basic pay. On these are extra things which are added on and which allows the feasibility of a person to grow. So having said that, there is one point. Dr. Sri Ganesh, you came in late. You didn't hear much of the talk. What are your thoughts? What is the downside
Dr. Sri
to
Ganesh
incentive?
is for the next session, ma'am. He is early. He is not late. He is early.
Okay, then let's hear from Dr. Ragini. No, I would hear from him. Yeah.
Okay, okay. I'm typically not for incentivizing because it's basically, of course, you can have the carrot and the stick. That's the typical way of thinking in any business. And there's a song also, Hindi song, no? In Three Idiots. Kadi varna chadi. So that's the whole thing. I mean, you incentivize, but then there's a amount of greed that comes in, and there is no end to greed. See, for everything they will want an incentive. To do work, they will want an incentive, and then there's a competition, unhealthy competition. That they suppose you incentivize a doctor to see more cases in the OPD, you get more or more surgery. Then they will start corrupting the staff. They will say, we will give you something if you put more appointments for us, or if you convert more for us. So this is a corruption that comes in the system. So I think money is not the only driving force. If, for example, if you take missionary hospitals, I mean, there's a lot of work being done. There's a lot of passion there. I think there are higher values that need to be kind of emphasized to your staff and to your whole team rather than just money as a driving force. Because tomorrow another organization comes next to you, they pay them more, they're just going to shift. They say, I'll give you 10%, you're getting 5%, they're just going to shift. So money is a very poor motivator, and I think an organization that runs like this is heading for a downfall. I think it's a very short-term kind of a solution, but over a long period, if you want to build a strong organization, I don't think money is a factor.
No, agreed, sir. Like I mentioned in my talk, the idea is not to give money. The idea is to reward for good performance. The idea, like I mentioned, the very typical example that you gave, that's the one thing which we have to stay against, is to ensure that they are incentivized as a team and not as an individual. So if it is, I mean, especially if a team is taking care of a particular role, if it's an individual responsible for a particular specialty lone person, it's okay. But if it is a team, like let's say a group of cataract surgeons, it's important that they have to have divided as a team so that they work together as a team and gel together as a team. The idea is that there is a self-sustained growth model, and when they see a certain growth of the organization, but they are left behind, then I think it hurts every particular individual, however good, however not motivated by money they are, it does still bother them. So when they see a certain linear growth for them along with the growth of the organization, they feel a certain sense of belonging, a certain sense of ownership towards the hospital that they are running or being a part of, and definitely helps when you are having multiple centers where senior individuals are actually running that center and know more about that center than yourself. So they are there and they motivate each team. In fact, they are the ones who fight for appraisals, salaries and incentives for their junior team members. And that is the kind of leadership that can be inculcated in each of these individuals, because they have a sense of ownership. They are a promoter and they are a partner, but not just an employee.
Dr. Unni, your thoughts?
Yeah, what Shreyas said.
And I would want Dr. Ragini's thoughts before we can go on to the next session.
No, Shreyas, that was a brilliant talk. I'd like to just simplify to a point of oversimplification. Every institution needs targets. So when you have targets, there are two types of outcomes. That is a target with an incentive. That is a direct remuneration. And there is a target which is unset, without an incentive. It's unset. It goes on to performance analysis, seeing how valuable the person is to you. So a target is different from an incentive. And then there is one of the best tools I have used is an incentive without a target. It sounds very strange, which means that if your center is doing well, it doesn't have to be a target. It can be a general sharing in which you give employee A to employee Z something, maybe based on their performance or whatever, but everybody receives something. That is an incentive without a target. One more point I'd like to add to this, a very critical point where all of this goes wrong, as Dr. Ramamurthy said. When your assessment of the employee's worth doesn't equal his own assessment of his worth, that is when all the bad points of the incentive system come out to the fore. So please make sure one thing is, celebrating them as a team. Okay, it is good. But inside that also you could have unhappiness. So when you have incentivization, this is a challenge. My main weapon against that is my own personal thing. I am extremely unpredictable. So they wouldn't expect the same thing every time. So sometimes that helps, sometimes that doesn't help.
I'll just
That's
quickly
so
add a
true
point,
with
sir.
everybody, I think.
One thing maybe I probably failed to mention is that make it exceedingly transparent for each individual team member about what their incentive is for or what their additional bonus is for. Very often when I interview candidates from some other center, they say this is my fixed and this is my variable. So if I ask him, why were you given this variable? He says, no, I was given this additional 3,000, 4,000 or 5,000 for this month because overall we did well. He doesn't know why he was given that or on what metric he was given that. So being extremely transparent on even at the beginning of the month, if they know that if I do X number of cases or per case, this is what I'm going to get, and they are able to calculate. In fact, our staff, our seniors will correct our own accounts team if there are some errors in terms of their calculation. So transparency is extremely important along with the motivation.
Ragini ma'am.
So quickly, you know what, I would agree with Sri Ganesh Bhai ki individual incentives are very bad because they are pitting individuals of your team against one another, and then it doesn't work as a family. So the center or the team or the organization would suffer. But incentives as a team, like my OT team performs very well because they go for camps with us, and we put them as an example of how devoted they are to the patients, and we give them an example that other people should work like this. But in that team, if I separate out an individual, then he would be separated from his peers and they would not be close to him and all that. So I am very much against individual incentives. It doesn't work.
Thank you.